somebody's shown her the technique but didn't want to get their goobies on her inhaler, so they've just, you know, kind of faked it, and so that she thinks that that's the proper way to do it. And the trick is simply, when you teach someone to use their inhaler, get them to use it in front of you. So this is a study of poorly controlled asthmatics. Half of them had when their inhaler technique was assessed, they were found to be both non-adherent and have poor compliance. 40% were trying but had poor technique. Only 10% were actually just non-adherents but knew how to use their inhalers properly. And then 2% of asthmatics with poor control had good technique and good adherence. So good technique's important. There are lots of common errors, but also some really bizarre errors. All inhalers, it's important to breathe out first. Also to breathe away from the inhaler, because if it's a dry powder inhaler, you don't want moisture in the inhaler because it affects the dispersion of the powder. And to hold your breath afterwards. For a MDI, there needs to be a pause between breathing in and spraying, because if you spray first, it goes on the back of your mouth. So you need to start the breath first before you spray. These are the errors. This is not the correct way. So people spraying and then going too late. People doing fast sucks, which is the same as what you're supposed to do with dry powder inhalers. But with an MDI, actually supposed to breathe quite slowly. And people squirting in 2 puffs into their spacer at the same time, which is a big no-no. And lots of patients come to me saying their nurse educator told them to do this. I'm sure it's not, but it just emphasises the importance of getting the patient to actually do the technique in front of you, because what they hear might not be what you said. Turbuhaler, failing to hold the device upright. Just a technical thing, the powder is stored up high and has to drop down low. So if you load it sideways, it doesn't drop into the chamber to breathe it in, so it's quite important. It's 2 clicks, 1, 2. A lot of people only do 1. And there's these little jet holes, and people often put their lips right around and cover it. Why do people have such bad technique? Less than a quarter of asthmatics have ever had their inhaler technique checked. So we tell people how to use their inhalers. We don't check they've actually learned what we've said. Up to half of doctors and nurses don't actually know how to use inhalers properly, and that goes up to 85% for turbuhalers. So it's one of the other reasons I don't encourage prescribing of turbuhalers is doctors and nurses don't actually know how to use them, so you can't really prescribe them. It does take repeated education. It takes 3 visits to teach someone how to use a turbuhaler properly, and people forget. And I seriously have patients I teach every 3 months how to use their inhalers. And this is the same data as that from a research study. They gave people turbuhalers and randomised them to special education or not. People with no education, a few of them learned how to use the turbuhaler by themselves. Well, this was standard education. With in-depth education, 85% got correct after 3 visits of education, but a whole lot of them forgot over the next 3 months, so they had to be re-educated. I don't think you have to have a perfect score here to be good enough, but it just shows the difference. So ensure your own technique's correct. Workshops like this, I have to teach myself with YouTube videos, so that's available. Always get the patient to demonstrate the technique. And one of the recommendations was you write out a little checklist and you attach it to the inhaler, and you can, if they're doing one thing particularly wrong, you can highlight it. Okay. All right. So I'll go first. So what I've done is I'm going to try each inhaler, and then you can spot anything I've done wrong. I'm not going to pretend my technique's perfect. And then we'll check the checklist, because there might be things on the checklist that are surprising. And the checklists are actually quite finicky and pernickety. So the first thing is this inhaler hasn't been stored properly because it's got its cap off, which means little foreign objects can get in there and you can inhale them. So first, take off the cap. Doesn't have a counter, but if they're on a preventer, they've all got counters now. So to make sure there's actually some medication in here. Shake. And then I'm going to breathe out away from the inhaler. I'm going to start my breath in, which is going to be about a 3 to 4 second breath, and I'm going to squirt and I'm going to hold my breath.
You squirted first before you started breathing?
No, all right. And then I need to shake before the next puff and put the cap away for storage.
Sorry, either I'm really wrong, or I think this is why are you doing what you just did when you should be using spacer?
Yep, that's very good, but there's a lot of adult patients using this.
But isn't that our job?
Yeah, yep,
To try and encourage them to
yeah,
use that spacer so that they
yeah,
can benefit from it?
yeah.
Yeah.
But we,
Just us.
yeah, no, you're absolutely right, but we still need to know how to use the inhaler properly. Okay. All right, cap off, check the dose, check it.
So you're breathing out first.
And then hold for a fast count of 10, which should take about 5 seconds.
That's right. What you're saying is there are adults using it, so they should at least use it correctly if they're going to use it like that.
Yeah.
The only problem is when you come to educate them, so you say you should, preference is the spacer, so it's
Yeah.
more effectively. If you're not using that, you don't have it with you, then
Yeah.
say,
Yeah, but I think it's more important everyone in this room knows how to use the inhaler properly. So, remove cap, check dose counter, hold inhaler upright and shake. Didn't hold it upright. Shake well, breathe out gently, put mouthpiece, good seal. So that's something you really need to look at and watch, that they've got a good seal. Start to breathe in slowly through mouth and at the same time press down firmly. Continue to breathe slowly and deeply. I think I did all of that correctly. So the other thing is nobody ever died from having 1 extra dose of Flixitide or 1 extra dose of salbutamol, so you shouldn't feel afraid of getting the patients to actually check, bring out their inhalers and have them if you don't have a placebo device. And the problem is now we have to throw away this placebo. Where'd the other one go? All right. Okay, spacer. Let's get the funded one. So again, shaking first. Ah, well, you will enjoy the lunchtime presentation then. Actually, the valve's broken. And just there's a different technique for adults and children. I'm not quite sure of the adults' technique, whether it's 1 or 2 breaths, but it's big breaths and then a breath hold, whereas children it's just 4 tidal breaths. And again, 1 puff in and then 4 tidal breaths. You'll enjoy the lunchtime presentation. And I'll talk about spacer care at the end if we've got time. But the biggest thing I get is patients putting 2 puffs in here at a time. It needs to be 1 and shake between each one. And why do you have to shake between each one? Yeah, so there's actually a dose preloaded here, and when you squirt it loads the next one, and if it's not shaken then the dose that loads will be all propellant because the medication will be floating up. So then the concentration will change within the inhaler.
I have a question. In the medicines, in the relievers, blue one, that are like, for example, the Respigen, one of the instructions say that you have to give in between a minute. All right? So, but for Ventolin, the reliever, which is the blue one as well, it doesn't say anything like that. So, I received an instruction that general, we need to give them dose in between dose a minute apart for all the relievers, but the instruction, it doesn't say.
Yeah, so I think that's a very American thing. Is
it the next side here in New Zealand?
Yeah, so I would ignore that and just give the 2 together. Because in the US, when we talk about this on chat rooms, they're always going on about how a nebulizer takes 10 or 15 minutes, so to give 6 puffs should take the same amount of time, which is actually complete nonsense. There doesn't need to be a...
It's in the means, isn't it?
Yeah.
New Zealand.
Is it?
Yeah.
Yeah.
You always take your patients to wait 30 seconds between two puffs of anything. So it's kind of
Interesting.
good, not just breathing it back down, second puff.
Do you get into breath hold?
Sort of 5 seconds.
Hmm. There you go. As I said, I didn't expect my technique to be perfect.
Which one do you want?
This one. Okay. Anyone feeling brave? All right. Okay. Face the crowd.
Yeah. So I would take the cap off. I have asthma myself. I used to use these, but I found it a little bit crap when I switched to Seria. Maybe it's because I'm not using it properly. I don't know. So I would hold it upright and see how many doses. There's 120 doses, and then I'd turn it forward and back until I hear a click, and then when there's a click, I put it to my mouth and suck in, which I can do with this inhaler because I don't have COPD. And hold my breath for 10 seconds. And then breathe out slowly after that.
Yeah, and then reload for the next one.
Okay.
Any comments?
Yeah.
Sorry?
Breathe out first.
Yeah, didn't breathe out first.
Okay.
Anything else? He did 2 clicks. Anything else? Yeah, short, sharp breath. So that's when it gets confusing switching between devices. As an MDI is a slow breath. So the turbuhaler is quite difficult. You have to hold it upright, so the dose has to drop down. You can't breathe into the device because it gets moist and the powder clogs. And the other thing is it's got these special jet holes for the air to come in, and that's because the powder has to be smashed up into a fine powder. So you have to suck short and sharp and hard, which is different from all the other inhalers.
AstraZeneca have the little whistles that you
Yeah.
can get into the bone, which will sound of the sucking
Yeah.
in.
Yeah. And the other thing with the turns, there should be 2 turns, one of which is a click, and it doesn't matter if it's the first or the second one. So that's fine, or that's fine. But just make sure there's 2 turns and 1 loud click. Yeah. Oh, hang on, sorry, we didn't go through the... So MDI and spacer, assemblable spacer, remove the inhaler cap, check dose counter. So I guess that's something we actually need to think about. Do we need dose counters on our salbutamol? Hold inhaler upright and shake, insert into spacer. Good mouth seal is really important, or with a mask, a good seal is really important. Breathe out gently into the spacer. And what we're trying to do here is time, just like we did with the MDI, timing the breathing with the spray is still doing the same with the spacer. And so for children, breathe in and out normally for 3 or 4 breaths. Remove spacer from mouth, breathe out gently. Yep. Okay. And store with the cap on, which I know in our house we've got a whole lot of inhalers without their caps. Turbuhaler, unscrew and remove the cover, check the dose counter, keep inhaler upright, twist around and back, breathe out gently away from the inhaler. That's really important with the turbuhaler. Good seal, breathe in strong and deep, hold your breath, and then breathe out gently away and repeat. Anyone know how to use this?
Yeah.
I'm not sure I do. Anyone want to have a go? Come on, I know you do. Come on. No? Come on, Tom.
So check the counter, 59. And my understanding is you open it and that loads it. You're testing it here. Presumably you've got to push that down as well.
Yeah, so that loads it, is pushing that down.
Yep. And breathe out. That's what I did.
Yep, cool, and so just like the turbuhaler, it's important not to breathe into the thing because you'll get the powder wet. Unlike the turbuhaler, I think it's a fine powder, so you don't have to suck hard. You load it by this, and then this thing flicks back when you close the lid. oops, wrong way, close the lid so it flicks back into position. And so the important thing, that I find really confusing, is this, to double the dose in here. So instead of 2 puffs twice daily, it's 1 puff twice daily, but it's the same amount of medication. And I think that tricks quite a few people as well. I went for a long time thinking this was half as strong because it was a powder, until somebody pointed out actually it's just 2 doses in 1 puff. Thank you. And I think we did everything correctly. So yeah, breathe in steadily and deeply instead of short and sharp. Okay. I'm just going to race through this because I can see things out there. Spaces. These next 2 slides are things that people never ever do. So the problem with spaces is the static. This plastic is non-static. So priming is a thing of the past. But the standard instructions we used to use 10 puffs, which is an incredible waste of money. But so much better to wash it in warm water with dishwashing and let it drip dry, which leaves the detergent on the inside and primes it for you. Likewise, it should be washed monthly, which I've never seen any of my patients do. Drip dry, not rub it dry because it's static, and I think you still need to do that with these.
Sorry, do you need to replace this one?
And replace 6 monthly. Yeah, I think you probably do. Yeah. And so with this design, they're recommending 4 breaths instead of 6. So that's why. But also, I've switched to 4 breaths a long time ago because 6 breaths is just silly. But so it's quite good that the message will now be 4 breaths, so everyone will be saying the same as me. MDIs. I thought this was really interesting when I read all this because I knew none of this information. You need to store it upright because it evaporates. If you store it sideways, you'll lose a lot of propellant. I don't think anyone in the world does that. If so, likewise, remember I told you that when you discharge it, the next dose loads. If you leave it for more than a week, then it'll have evaporated. So if you haven't used your inhaler for a week, you need to discharge it a couple of times before you use it again. The powder clogs up in here, all the brands, but I've never seen a problem with the Ventolin. But actually it's supposed to be rinsed clean every week and left to drip dry. And you can't put this back in while it's wet because that'll clog it up. And there's no reliable way to tell if your inhaler's empty. Nothing works. Sometimes the spray will stop when you're out of propellant, but you've still got medication. Sometimes the spray will continue when you're out of drug, but you've still got propellant. You can't tell by feeling it. All that floating stuff is rubbish. Which is why I'm thinking maybe we do need salbutamol to have counters on it as well, because that's the only way to tell. But the other thing is just to write down the date. And if you're using it twice a day, you should go through them every month and throw them out every month.
Write the date on the canister.
Yeah. It's quite easy to put a little sticker on here. The end.